which will establish tangible steps on a concrete timeline toward creating a system of guaranteed health care for all Californians that will provide better care at lower costs in the following ways. By directing the Secretary of HHS to pursue waiver discussions with the Federal Center for Medicare and Medicaid Services to facilitate the creation of a unified healthcare financing system, require the Secretary to establish a waiver development work group of diverse healthcare system stakeholders appointed by the governor and leaders of the two houses, requiring the Secretary to provide quarterly reports to the chairs of both health committees on the status and outcome of waiver discussion with the federal government and the progress of the work group, and requiring the Secretary to submit a complete set of recommendations regarding the elements to be included in a formal waiver application by no later than June 1st of 2024. Colleagues, we know that the fragmentation and inequities of our current healthcare system, some of which we've heard about in the previous bill that just presented today, including varying health plan eligibility requirements to the continued lack of effective oversight of health plans, is harming California residents. These shortcomings result in severe and sometimes lethal gaps in medically necessary health coverage and disproportionately harm historically and systematically marginalized groups. In their final report, the Healthy California for All Commission summarizes the characteristics of a new unified financing system as all California residents being entitled to receive a standard package of health services, including long-term care support and services. Entitlement will not vary by age, employment status, disability status, income, immigration status, or other characteristics, and that distinctions among Medicare, Medi-Cal, employer-sponsored insurance, or individual market coverage will be eliminated within a system of unified financing. The report estimates that universal coverage through a unified financing system will save 4,000 or more lives annually in California, and finds that in the absence of a shift to unified financing, California will incur an additional $500 billion in medical costs over the next decade. SB 770 for the first time establishes the support, will show the support of the legislature for the work that the Healthy California Commission performed, along with clear steps to resolve the many policy and financing issues that the Commission left open. The approach proposed by SB 770 will develop the required policy and financing details while building political support necessary to achieve our shared goal: guaranteed health care for all Californians as soon as possible. Despite some claims from the opposition, we are committed to working with everyone interested in a better healthcare system to ensure we achieve this goal and make it a reality through a statutory pathway. SB 770 is sponsored by the Healthy California Now Coalition, which is a huge coalition of labor, healthcare advocates, civil rights advocates, and others, and I respectfully ask for your aye vote. With me today to testify is Dr. Jeff Frazier, MD, and Ada Briseño, the co-president of Unite Here Local 11.
Please go ahead whenever you're ready.
Good afternoon, Chair Wood and members of the committee. My name is Jeff Frazier, and I'm a retired neurologist. For 30 years, I practiced at Santa Clara Valley Medical Center, a large public hospital in Silicon Valley. I served as department chair for 5 of those years. I have seen the inequities and the follies of our current healthcare system, and I have personally dealt with the problem of physician burnout. I believe that only a single-payer, not-for-profit healthcare system with universal coverage will provide the necessary foundation for solving the burnout problem. SB 770 lays out a path to achieve the necessary reforms. Without such reforms, the burnout problem will only worsen, and the physician shortage crisis will snowball.